We begin with Professor Eva Fuhrman's presentation. Eva is Director of Innovative Policy Center in Finnish Innovative Institute, Syke. She has wide experience in sustainable development and mainstream biodiversity. After that, we will hear Professor David Heyman's presentation. David comes from Massey University in New Zealand. He has been working widely at the intersections of human, animal, and environmental health, and recently, for example, with biodiversity and pandemics. Then we will continue with senior expert Josefina Infidag. She works in research and innovation at European Commission, and her work focuses on biodiversity research. She works, for example, with the European Partnership on Biodiversity and Horizon Europe's work programs for biodiversity research and nature-based solutions. After these talks, we will listen to Saara Vauramo. Saara works as a program director at Lahti European Green Capital 2021. Saara has wide experience in sustainable strategic thinking and transdisciplinary cooperation between researchers, business, policymakers, and citizens. Great to have you all here today. And then we will have time to questions and answers. Please write them down in the chat, and our researchers Marianne Aulke and Terhi Aro will moderate the chat and ask questions and give floor for answering them. Our discussions today are linked to HERA research project. We are working with health, environment, climate change nexus and looking for research goals for future research. We have been defining that there is need for transformational change in this nexus and also more detailed goals. And today we are focusing on this research goal 1, how climate change and biodiversity loss are intertwined and how we could reduce effects on health and the environment. And more precisely, we have there in our agenda one goal, sub-goal, health and biodiversity loss. And that's our more detailed topic for today. We have been concluding that there is an urgent need to explore and understand the mechanisms linking biodiversity and human health, to define effective ways to avoid negative health impacts of ecosystem degradation, and to support positive health impacts of biodiversity in Europe and also globally. And there's a need to integrate biodiversity, environmental risks, and climate change from solution-oriented perspective. And towards this direction, there's also need to co-create, experiment, and implement relevant health-promoting innovations and interventions. And these conclusions are in line with our key findings that we received based on our extensive stakeholder engagement across Europe during the last few years. We found out that there is an urgent need to deeper understanding of the complex and cumulative health impacts of environmental risks, paying special attention to vulnerable groups. But also that there are potential synergies that can be achieved by integrating human health and environmental health issues to all social sectors. We believe that addressing the multifaceted health-related challenges in a more systemic and transdisciplinary manner would contribute to the development of improved risk management practices and integrative policy and decision making. In order to support such development, practices for holistic research approaches, including social and behavioral sciences and science policy society dialogue, should be mainstreamed across Europe. And finally, such society-relevant research could support future research in enabling a just transition to a sustainable and healthy future. Okay, these were the greetings from our consortium, and next we will continue with the presentation of Eva Fuhrman. Eva, please, floor is yours.
Thank you, Riikka, and thank you, HERA project, for inviting me. And I will just open my slide.
Now it works.
Yes. Okay, thank you. And sorry about that. Could I get the next slide?
No problem.
Please? Next slide, please. So nature is something that we usually see as soft, as a soft thing. And for example, people think it is pretty and something quite useful only from its. Sorry, now I can't see any slides.
Oh, sorry.
Okay, yes. So if I start again, so nature as a whole, it's seen as a soft issue, and it's seen from a kind of visual perspective. But if we take the next slide, we understand that actually it is a hard issue. It is functioning in a very systematic way. And we are talking about ecosystems and biodiversity when we are dealing with science. So this picture shows clearly how we are in ecosystems and biodiversity interactions such as competition and predation and parasitism actually are controlling species and populations in a very effective way, and this way they keep the population sizes of different species in control. So if I get the next slide, please. So humans are part of these ecosystems. We are only one species among the others. We are very dominating species, but we get the benefits of being in these ecosystems, which means that the different species, also the ones that are deleterious for us, are kept under control and are not being spreading highly. And from there, we are getting benefits which can be seen as health benefits. And the mental health and cognitive learning and immune tolerance are among those that are direct ones. But we also get indirect health benefits from these ecosystems, from biodiversity, which are like more motivation for mobility, food production, climate change adaptation, and control of health risky species and breaking down toxic chemicals. Could I have the next one, please? At the moment, we are in a situation where we see biodiversity loss highly in the globe taking place, as the picture in the right shows. But the most striking picture is the one on the left-hand side, where we can see that actually the biomass relationship between livestock and humans and wild mammals worldwide has really shifted to the situation that today we have only 4% of this biomass from wildlife. If I get the next one. Well, what happens to the ecosystems web and biodiversity when actually these certain parts of it are taken away through deforestation or biodiversity loss or agricultural practices? It means that these regulatory mechanisms are broken, and that means that species that are fast expanding and fastly reproducing are really emerging, and this includes especially several disease emergencies or species like viruses. So if I get the next one, please. And here is a good example how that is then affecting the host when we are talking about this parasite or predators we can see in livestock, in humans and in wildlife. numbers of outbreaks growing. So if I have the next one, please. But it's also a question of natural areas as a whole disappearing, and especially in areas where humans are or have been connected to nature, we see really the loss of this contact with nature. And if I get the next slide for that, there is a growing amount of research that also shows that with the loss of biodiversity and green areas, we see that several diseases such as inflammatory diseases and hay fever, but all non-communicable diseases are really spreading up and or increasing. And this is, for example, from the Finnish army cohorts showed a long time. So if I have the next one, please. So this research have really gone further, and we can identify what's the mechanism that is affecting this, and it is the microbial diversity that is decreasing at the moment, and we have a breakout of these non-communicable diseases because the environmental microbial diversity and the human diversity are not in kind of balance with each other. And if I have the next one, please. So you can also see that the research on mental health connected with biodiversity is really increasing, and this is an analysis of existing research projects and papers coming out from those, how different kind of mental health outcomes are showing up in these papers. And you can see there is affect, physiological stress and perceived stress, especially really raising up. And next slide, please. So the issue is that we have all these various kinds of challenges with human health connected with biodiversity. And the key issue is that we are not getting anywhere if we are solving them individually. And there's quite a lot of industry at the moment coming up with solutions where you can solve them one by one. But there are 3 reasons why we should not do that. One is that these really raise new problems. Once we get one problem solved, or something else appears elsewhere. This part of this whole idea how ecosystems and the planet is functioning. The second one, this really distracts our humans' attention from the root problems. And so we are not getting into a sustainable mode as a whole. And then the third one is that we are losing all the win-win situations that we could have. So if I have the next one, please. So one way to think about this is thinking about a house where the human health and human well-being is the roof, and the groundings of the house is the healthy ecosystems and biodiversity. And to be able to connect these, we need to transform those systems that are producing us not only health but well-being as a whole, ecosystem, economic system, food system, energy system, and urban system as the big ones that are unsustainable at the moment. And this is one step to the planetary health, having a systems approach. So if I have the next one, please. Here, this we can demonstrate through this slide where we take again the health deficiency in the youth, which has been clearly shown, and having different kind of illnesses, including obesity and mental health problems, fitness problems. We know that there is a connection to nutrition, to nature connection, and to mobility. And these again resonate very well with natural resources, biodiversity, and climate change. And if I have the next one, please. So we have a system level way to deal with this. So first of all, the education and communication for the health related sectors working there. And the second one is that we secure the natural environments, and the third one is the building infrastructure which motivates for muscle-based mobility, and then fourthly support sustainable food through business innovations. And the next one, please. And there are several approaches. This is again by Serge Morand and his colleagues. Very recent analysis again about the COVID and other pandemics, how to deal with it from a One Health planetary health perspective is that you reduce the antimicrobial and pesticide use. You really again conserve ecosystems and biodiversity, and in particular you strengthen partnerships and governance. And I will finish with one slide which again takes, if I have the next one, puts us into a more practical and human-oriented way. This is the nature step to health that Hartela and his colleagues has launched, and now it has been initiated as a program which will be distributed around from the Lahti, and we will hear more of that. So the nature step, again, there are several different angles that need to be connected in a systems way. So thank you very much. You can put the next slide. And sorry about the technical systems. We tried them before and everything worked, but life is like that. Thank you very much.
Thank you, Eva. It was an excellent start for our webinar. Great presentation. And I was thinking that there is no comments or questions in the chat, we could take directly David's presentation, because I see that these two presentations are really nicely interlinked. So David, would you like to continue from that, and then we could discuss after these two presentations? Perfect.
Sure. So, hello. Hopefully you can all see my slides. Someone will have to let me know because I can't see you well. Yep, you can see me?
Well. Yep.
Brilliant. So I agree. Thanks, Eva really set my talk up very nicely, or she could have gone after me. So that was really nice. So thank you very much for inviting me to speak. So I'm aware we're running a little bit behind time, so I'll try to catch up a little bit. But those global issues are really encapsulated in what Eva said. And some of the major issues we have to deal with are covered by the Sustainable Development Goals, which is really, we wish to end poverty, but also protect the environment. We want a sustainable future. And like Eva commented on, this idea of the planetary health is a great framework, a way of thinking about that. And within that, we can think about that extinction crisis, biodiversity crisis, the loss of species and ecosystem services around the world. And obviously climate change is a major problem for humans and life on Earth, actually, in its current form. So where do infectious diseases sit? And my focus really is infectious diseases. And I'm part of a One Health high-level expert panel with Serge Morand, who got a mention there, and some others working with FAO, OIE, UNEP, and World Health Organization around how to integrate that environmental aspect to health and how it impacts all of these different agencies. And we published some of this in an IPBES report on biodiversity and pandemics, and I'll leave that up at the end. So some of this is informed by work that we had there. So, why think about infectious diseases? And these agencies put this together, that at the minute we have, intensive animal production, intensive agriculture, ecosystem damage, climate change, migration, some urbanization and pollution. And we've also seen this rise of emerging infectious diseases. And the thought, and it's true, is that there's increased global interactions at that human-animal and environmental interface. And typically when people are talking about animal here, they're talking about domestic animals. And that comes from a slightly narrower view of health, if you think of planetary health, but typically this slightly older version of One Health, which is this more veterinary, medical, biomedical framework, but it should incorporate environmental health, and it's recognizing that they're interlinked. And I thought I'd just talk about two particular examples. One, Ebola virus emergence, which has caused an enormous public health tragedy in parts of West Africa, particularly, but also through Central Africa. And we really want to know, so where are outbreaks happening, and why do they emerge? And I'll touch on some science, and then we can go to some of the ideas. So there are wild animal mortality events that have been linked to Ebola virus. So these are dead animals found, and then the arrows in this graph just point to when there were human outbreaks. So duiker, which are little forest antelope, great apes, have died of Ebola virus. And really, there was an infectious disease that probably is endemic in Africa, but that was killing apes. And particularly in the 2000s, this statement, Ebola hemorrhagic fever is currently spreading through ape populations in Gabon and Congo, and now rivals hunting as a threat to apes. So, we have huge human health issues, but, conservation issues. And the question is, so how does this happen? We think that these are bat infections. And so this is a very small image, apologies, but it's about the only evidence that, strong evidence, there's other evidence, but this is really strong evidence that bats are the host of Ebola viruses. But it's bitty. And what I'm showing you here, these are these family trees, and the different colors represent viruses from different species. And the key thing here, this is Ebola's cousin, if you like, Marburg virus. And in the red and the green, hopefully not red-green colorblind, but red-green are the bat viruses, and then the human cases are in the blues. And the point is here, they're mixed up, and it's evidence that humans have got infection from Ebola's cousin direct from bats. So these are cave-dwelling bats. So what's happening in nature, and why is this a kind of One Health, public health issue? What's this got to do with biodiversity? Well, so we know humans are infected. We know humans can infect humans. We know people have been infected from great apes. We don't know what happens with those, and also these little forest antelope. But we really don't know what's happening in terms of the linkages between them and other species, and probably bats, but we don't know which species and whether there's other things like vectors involved. And there's evidence that some other species have been involved. So these are potentially quite complex systems, potentially involving lots of different species. But humans, obviously, we're worried about human health, but also conservation when it comes to gorillas. So if we just map the distribution of these bat hosts, you can see there's basically the brighter colors are where there are more of the species that host Ebola viruses or filoviruses in this. But actually, the observations, and again, you have to just take my word for it, the observations are where the outbreaks took place. And this is are little areas where there's localized forest fragmentation. And this is where we get into this idea of change, environmental change causing, disease outbreaks. So you may not see this from this map, but this map is actually forest change over a decade. And the lighter areas are areas where there's been more forest change, and the dark green is where there's sort of still contiguous forest. And it's quite hard to see from that, but I can tell you that there are areas at hotspots of forest fragmentation, and these are what this is what this sort of looks like. So this is a picture of mine from Uganda, and you can see that there's encroachment into natural habitat. Now, of course, people have been living in these environments for millennia, right? But it's the pace and the scale of change that is happening today that is different to what's happened. And you can imagine if you took those maps, this is what we did, this is what you'd see in pixels, right? So this is how we do the analysis. We convert pixels and say whether they're a patch of forest or whether it's a fragment or core. And we can really look at that. So this is like a map of forest density, edge density rather, across Africa, the tropical forest. And this is where we look at the size of the edge and then the species diversity within those pockets of forest. So you can see that's slightly different to the forest edge. This is, if you like, our hazard. This is where people live. This is where the people are. And we can do things like look at human population density and think about how they might spread around Africa. And I'm coming to a point here. The last map is actually where we think there's these intersections between where people are and where there's biodiversity, there's fragmentation of forest. And if we put that together, this is a sort of map that we get. And my point here is that we're showing you areas where we think diseases will spread, but also where they'll come from. And they're coming from these highly fragmented biodiverse regions that intersect with high population numbers. And this map actually picks out where Ebola virus outbreaks have occurred. But I can tell you this map here has nothing to do with biodiversity. This is just a map of forest fragment size and our model and human population density. And it actually picks out locations where you're seeing outbreaks. So, you know, if forest fragmentation is a risk, then reducing it should reduce the risk of disease emergence. And then that makes us think, so what are the drivers of forest fragmentation and loss? And those will differ depending on where you are around the world. But there are other drivers in thinking about conservation and what we're doing. So this is from that IPBES report, and this is the monetary value of traded wild animal products or plants as well. So, and the key point here is if you look at the scale, the difference, the monetary value of products. So this is live animals on the left, animal products in the center, and plants on the right. And there's a 5 times increase in the monetary value of legally traded animals. And when we say legally traded animals, some of these animals are being traded in millions of, well, there are millions of animals being traded each year. And so this is the legal trade. And I'll come to another example in a minute of where that can be a problem. Of course, there's subsistence trade and there's subsistence use, but some of this can be largely mechanized. But this is an example of, we see this throughout parts of Africa with, you know, just hunting of fruit bats. And, you know, people have been doing this for a long time. But actually, the scale of this in some locations is now quite large, and that's a problem for conservation, but it's also a problem for potential disease transmission. So if we think about last sort of subject in this, or no, I've got 2 more actually. This is thinking about SARS coronavirus 2 emergence. So it's not clear exactly how SARS coronavirus 2 emerged, but of course we're all interested in it. The virus at some point has bat origins, and this is a great phylogenetic tree. And the point about this is you've got SARS coronavirus 2 that causes COVID is in the red at the bottom, and a bat virus is its still closest ancestor. But you may not be able to see it, but this is again a family tree. The branch length suggests that the closest relative is still some time ago, so we don't quite know what's happened. But you know, some of the early cases and a lot of the cases were clustered around a market in China, and markets in China are just selling all sorts of things. But it can include, you know, different animals species, and you know there are risks with having live animals in some of these markets. And you know, if I go back to this, even though we don't think pangolins, or the viruses have been found in pangolins, are the ancestors of SARS coronavirus 2, there are SARS-related coronaviruses in pangolins. And you know, this is an example of confiscated pangolins in Indonesia from a few years ago. The pangolins are a species that are threatened with extinction due to trade, but they've also been identified as the host of a SARS-related coronavirus. And you know, that's the same. So masked palm civets that were linked to the first SARS outbreak in 2002, still being sold in markets. But you know, wildlife are not the only risk factor. Domestic animals are a huge risk factor. They're a great place for infections to spread among, because they're high density. They're similar species, great for infectious disease to spread through. But also livestock production is a major driver of land use change. So this is where some of that complexity and some of those drivers and the linkages become important. We've tried to look at that, and we've looked at within bat areas, and we looked at, for example, so ignore the top left, but we looked at livestock density, which is on your top right, forest fragmentation hotspots on your bottom left, and then human density on your bottom right, and sort of put that together and said, well, where are the hotspots? Where might you expect if an infection is able to be transmitted between humans, domestic animals, and livestock? Where might the risk locations be? And so we highlighted kind of hotspots. But these are really then trying to say, well, what would you do, and where would you go to do surveillance? But we also then, and excuse the busyness of this slide, looked at, you know, what would happen if you change something in an environment. So, for example, if we take Japan, which is up on the top right, we looked at Japan and said, well, if you had more forest fragmentation in Japan, that might push it to be an area where you've got greater disease risk. And that's trying to think about what processes might you not want in areas to reduce disease emergence risk. And these last few slides, because I think I had a bit longer than Eva. So these last slides is just thinking about globally. This is quite an old publication now, but by Kate Jones and colleagues. And this was looking at zoonotic diseases from wildlife, domestic animals on the top right, drug-resistant pathogens and vector. And I just want to highlight two things. So this is the risk in Africa from a statistical model. Those came from data, and this is the data from Africa. And I'm just going to show you the last few slides of the laboratory capacity for a range of different laboratories in Africa. So this is the WHO antimicrobial resistance network. These are the children's environmental health, there's none. Influenza labs, OIE labs, this is animal health collaborating centers, pre-qualified labs for medicines, and some TB labs. So my point there is that you've got a hotspot, but you've got very little capacity for detection as well. There's some examples where there's some twinning and there's some more equal distribution of labs, and there's some great efforts to improve the situation. This slide I want to leave in because this is from measles and rubella, which is a human-only infection. But my point about this is that there's quite equitable distribution of the laboratories, showing that you can't. It's not a capacity thing in some respects, that you can have good, functional, well-working laboratories in all these countries. So just to sort of summarize, because that was quite a quick overview, I think we need to focus on have an equity-focused global health agenda, and we need to coordinate between sectors and really go into this point, think about understanding the drivers and mitigating those drivers. And we had some of these recommendations in the ICBES report. We tried to propose some enabling mechanisms, which included things like intergovernmental panels, policies that looked at land use change and pandemic risk. So really considering, like, thinking about what you're doing to the environment that might lead to increased disease risk, reforming financial aid for land use so that it benefits biodiversity and health, and some other policies around, say, trade, closing knowledge gaps, and really fostering a role for all sectors of society to reduce pandemic risk. So these are a couple of reports on emerging infectious diseases that are quite comprehensive, and thank you very much.
Thank you, David. It was excellent presentation. And yeah, I was thinking that do we have questions in the chat? And yes, we do. Would you like to introduce us? Thank you a lot, David.
Cool.
Let's continue.
Yes, I can see that there's a question from actually Sarah, one of our speakers. So she would like to ask from both Eva and David, where do you see most hope currently in increasing awareness and creating system level thinking? And if there are any good examples that you can share.
Yeah, does Eva want to go first? Because I've just spoken a lot, but I'm happy to answer that as well.
Do you want to start? So I think a moment.
Eva or me?
You can start.
Okay. Yeah. Sorry. So in terms of awareness, I mean, I would argue that to some degree, the evidence of the interactions between all this are shown by, for example, me being on this high-level panel, which links. It's the first time I think UNEP, the UN Environmental Programme, has really worked with FAO, OIE, and World Health Organization. So, and I think actually, ironically, I think some of the issues around the pandemic have made people think about this more. In terms of awareness, I mean, I think some of the kids, actually, I mean kids as in, I don't mean that dismissively, I mean my own kids are much more aware. I think some of the youth, not all. But this systems level thinking, I can see some great examples actually from poorer countries than countries that I sit in, like New Zealand or my home country, the UK, where people that are living in this and they're working in the ground and thinking about, for example, zoonoses, which is where my interest is, really understand it. They totally get that humans are getting sick from their contacts with animals, but also that there's a range of other reasons that people are in poor health, and it is linked to the environment within which they exist. So I think there's some really excellent examples from a range of countries that are less well off than my own. And I can think of examples around Nipah virus in Bangladesh, some zoonotic work in Kenya, avian influenza work where people are in Southeast Asia, where people are really trying to understand, their farming systems and where novel infections are coming from, and hopefully then beginning to try to mitigate them.
Okay, thanks, David, and thanks for your wonderful presentation. And now I try to answer from my way to Saara. So, yes, well, I start with what I usually end is also the youth and the young. I think the young are very wise today and active, and they will do the big change. But there are lots of things going on, and we must say that COVID has given some, have been catalyzing things and making it more important, and people have woken up. And if we think firstly on a broader level and global level, there's lots of initiatives like this One Health and Planetary Health, but there's also something called One Sustainable Health, which is an initiative that is really writing at the moment recommendations to the World Health Commission or summit, which is not connected to the UN but is separate to it. That in UN there is a lot of things like the panel that David is part of. I think that is really crucial. But then coming actually when we are talking about the systems level, so I think the societies are waking up, and I agree with David that actually in developing countries it's almost somehow more natural that people who are working on similar kind of issues that are connected to, they are aware of each other. But in countries like in Finland, we are much more looking at things in a bigger scale. And even though at the beginning it was seen as a scary issue because it makes things complicated and you can't give and deliver a direct answer, it is still a way where you in a natural way collaborate with issues and people that are working on same content in a way. And I think cities, because cities and municipalities are more compact, that's the places where things are happening. And I think one issue that is taking cities are brought as a place where transformation takes place. It is because it's a sort of more compact and you can practice it more better in a better way. So inclusiveness is really important in that sense. And saying that health as a whole is quite a good, it's quite a good sort of issue for the mayors and the leaders of cities and even governments to raise, because people are worried about their health, and then also health system is the most expensive one for the public sector to run. So it takes a lot of money, but it's also something that worries, and if you want to have voters, health is a very good angle. So I think this is also something very important to see where leverage is taking place at the moment. Sorry about the long answer.
Good at answers in your way, and a long way answers are needed here. I think this global challenge that you two are raising here and linked challenges for municipalities as well will be discussed in the next presentation. I really appreciate this global start, because this is really in line with what our key stakeholders have been also emphasizing, that we should be able to be aware of these global major challenges and also be able to approach them on European and local scales, and how these multiple scales are linked. Thank you for this excellent start, and I would like to ask Josephine Enfidag next to continue from this presentation, how these grand challenges are affecting on European future research and what we should think about those.
Hi.
Hello.
Can you see me? Can you hear me? Hello?
Yeah, we hear you.
Yes.
It's not so
Thank you.
loud, but
Maybe I can help this. Thank you very much for inviting me. This is a really hot topic now in the Commission, because we are, well, for obvious reasons, for the pandemic situation, but also because we are now co-developing the work program for Horizon Europe for the next 2 years. And maybe you know already that we are doing it in a co-creation mode with other DGs. We are trying to involve our colleagues from other points of view. So health, so trying to connect policies and sectors that were not covered before, and health, biodiversity and health is one of them. If I might share, I don't know if it's going to work to share my slides. Okay, I think I'm gonna do screen instead of window. Let me know if you see them.
we see you, but not in the presenters.
No, this is where I'm trying slideshow.
Okay.
Okay, is it correct?
Yes, perfect.
Okay, so I'm going to give you an overview of what do we have under the item of biodiversity and health. And I have to say that this has traditionally fallen between the cracks of the system until the pandemics, actually, because we have programs on health, mostly based on human health. We have programs on animal health in another DG, often funded by other systems. And the programs on biodiversity only marginally were having this one health and eco health perspective. So now, but still things have been done, and notably by the Biodiversity Partnership. And we're going to show you what is now ongoing, apart from you guys. What is in the pipeline, and what are the conversations that we are having now these months, because we are, as I said, we are writing the work program, but more importantly, we want to write some strategic agenda to see where are we going. I thank you very much for the 2 previous presentations, because they give me ideas on this strategic point. First, a quick overview of what we had in Horizon 2020. It was already an emerging area, but as you see, we have some contribution in some projects, but these are disconnected initiatives. We are now actually going to try to bring the portfolio together and to organize the necessary workshops to have this community together. This was focused on biodiversity, and on the left you have improving well-being and health in cities. So it was about nature-based solutions in cities mostly. And to the right, as I said, there was a call in 1819. I'm gonna see the show the details for this one, organized by Biodiversa, which at the beginning it was this is for small projects, but very good, because it actually brought an array of different perspectives. So it was not as focused as when we have big projects. And we made a top up for COVID. So it resulted in some pandemic risk oriented projects. So these are the projects that I show. Greening herbs, phenotype. So this is about, oh sorry, I don't even see my, I don't know if you see me. My cat just took the cable out and I don't see the slides.
For us,
we can see them.
Okay, so as I said, they are oriented to positive health effects of nature-based solutions, or different biodiversity on close to nature or to natural features. And the running projects are also to improve urban health. As I said at the beginning, this was what was done, and it was not a holistic a holistic approach. Nevertheless, I still think this is a very valid portfolio, and we are now working with the executive agency to try to do this feedback to policies exercise, to scan what are the results and possibly the knowledge gaps identified by these projects. You see, we have the big nature-based solutions projects, Naturvation, Project IREG, all these working with urban infrastructure. Well, the ones that are cited here have work programs or tasks that have been looking at the relationship with health, mental health, but also in terms of sometimes exercise possibilities or air pollution, etc. We have a report on microclimate regulation. We don't have a report on health, an overall report. As I said, we are working with the agency to try to extract. Sometimes this is the problem, that the knowledge and the best practices and the experience are very fragmented among the projects. Then we have Eclipse, and as you know, it's a science policy interface, and we ask them some requests, and they do often reports and knowledge synthesis. In this case, they did 2 reports on the impacts of green and blue areas on mental health, and this was requested by France and the WHO, and these were released only a few months ago, and now we are, and I will show later, we are asking them to continue this work of knowledge synthesis and prospective with experts on the links between zoonosis, health, and biodiversity. Well, more on this Biodiversa joint call, the biodiversity and its influence on animal, human, and plant health. This was the first time that a call, and it was led by the member states, but we finally did a top-up on the COVID part. The first time from any European project this was put together. So far we had only the health part and the nature-based solutions ones. So it's about the nexus between biodiversity and health, and we really want to keep this going and to put more efforts. But the problem often is also the fragmentation and the fact that is not only geographical fragmentation, type of disease, type of ecosystem fragmentation, and professional fragmentation of communities that are not used to work together, because we really want to have the ecology part, the ecosystems part with the possibly molecular and surveillance part, human health and animal and plant health. So this is as you see, 10 proposals have been funded, and these are the projects. So it's biodiversity as ecological barrier for the spread of antibiotic resistance. There was one focused on changes in African forest, and that was related to the previous speech, and what is the relation with emerging infectious diseases. Also about biodiversity in forest and urban gray spaces. This was the one of the 2 that received a top-up to try to see coronavirus in urban settings in Europe, especially in rats and bats populations. It says only rodents, but we added the bats. Others on mosquito-borne diseases in the relationship with climate change and biodiversity changes, and the diversity of forests. You see, these are the hypotheses on the different drivers. We would like to open lights on research on each one of them. So it's the nature buffer hypothesis, the landscape change, the peri-domestic species, the loss of resilience due to biodiversity loss, and the climate change affecting distribution of vectors. There are other projects from the microbiome to the ecosystem, and this is in marine protected areas.
Josefina, please, may I ask you a question? Are you changing slides? Because there are some challenges we have not. Perhaps we have not seen your latest ones.
I am the one started with Metro Driver. Do you see that one?
No, probably no. I'm sorry.
Oh dear. Just a second. Okay. Let me stop. I'm so sorry. I was changing slides. Probably I wasn't the first one. This thing.
some challenges today.
Can you see my? Can you see my? Okay, let me see window. I'm going to do this one. Can you see it now?
Yes, now we see.
I will send you the slides, and I apologize for not having sent them before. Do you see it in a presentation mode?
Now we see. Yes, now it looks good.
Oh, now it's better. Okay, so I'm sorry, I'm not going to say it again, but this is the list of the ones in ecological barriers, Africa, etc., and the rats and bats in Europe. We have others very, very high level, one holistic, from the microbiome to the ecosystem in marine protected areas, because it's also about wildlife health and trophic diversity, nutrition for bees, soil biodiversity, viral eco-evolutionary dynamics. You see, this is a very good portfolio where it was very bottom up, and we are very happy that this possibly can open new avenues to continue the lines. As I was saying, we did 2 top-ups to try to do coronavirus work packages to some of the projects that had been already evaluated. This was an emergency action that we did with the last few well, I was going to say the last few millions from Horizon 2020, but was not. It was just 1.5 million given to these 2 projects. So this was in the African forest and emerging infectious diseases. We asked them to add the coronavirus work package. And the other one, this one is, we actually are very, very curious of what is going to be the results from this one, especially taking into account that the coronavirus pandemic is longer than we thought, and they will have data from the different waves. What is the rodent-borne diseases in forest and urban green spaces, and what is the distribution of coronaviruses. So that is what was done. These projects started only a few months ago, even if it was the 18-19 call. But the point is that now in Horizon 2020, you know that we are driven by the European Green Deal, and for the first time we have biodiversity as one of the key priorities at the political level. So yeah, in practice that gives us more budget, but it's more important that we are now invited to a lot of discussions, and we can actually open a lot of research lines. This is what is now the Biodiversity and Ecosystem Services funding landscape in Cluster 6. We have all these areas, and just for you to know, 5 years ago we only had nature-based solutions and a little bit on ecosystem services. Now we have the understanding biodiversity decline, so it's about data and drivers of biodiversity loss. It could include health, not particularly, but it could. It's more basic research. The valuing and restoring ecosystem services. It could also include health, although these are mostly on natural capital and on ecosystem restoration. The nature-based solutions still has all this part of nature clinics, or the influence in well-being. Managing biodiversity in primary production mostly could be about animal health, but we are trying to fight with our colleagues from DG Agri to include, as I said, this is in co-creation, and sometimes it's a bit difficult to align priorities, but we want to include projects that can take in agricultural landscapes this continuum with wildlife and human and plant health and animal health. Then the transformative change, enabling transformative change, is more socioeconomic research connected with ecological research, and there is a lot to do on the nexus of biodiversity and health with other socioeconomic factors and indirect drivers of biodiversity loss. The connecting research and supporting policies, yes, that we have the Biodiversity Partnership, and we have some projects that want to support IBES or CBD. And finally, the biodiversity and health, which is a new item. This is a heading. Although we had a topic last year, well, early this year, we didn't have a heading. Now we really want to put it as a heading. So that means that the conversation needs to be it needs to happen. And the problem, as I can tell you, is to populate this heading, because okay, the obvious thing, we did it already. We have now under evaluation a series of projects. I have to say that this topic was very popular. What else is out there? We want to explore the connection between biodiversity, ecosystem services, pandemics, and epidemic risk. I expect to fund between two, 3 projects, medium-sized projects, to do the 2 parts, the molecular characterization of emerging pathogens and their hosts in natural areas, and the relationship of biodiversity loss, land use change, and ecosystems dynamic with the spread of microbiomes. And yes, it should have some part of socioeconomic driving forces, but we expect a lot of these projects. And mostly case studies, because this is not in Europe, this can be everywhere in biodiversity hotspots. And if they cannot do everything, and we expect the 3 projects to be as different as possible, at least they will identify what are the areas to keep working. Then the second one is nature therapy. So it's about the MBS part. So to quantify and to demonstrate health benefits from biodiversity and from nature-based solutions into health, but also medical practice and therapies. And then the third one, which is more high level on transformative change, on socioeconomic research for the nexus on biodiversity, water, food, energy, transport, climate, and health. And I have to say that maybe we didn't write this topic very well a few months ago, or maybe the community is still not ready, or maybe the several communities that need to come together to be able to apply to such a topic are still not talking to each other, but we haven't received enough applicants for this Nexus project. We are going to open it again, maybe trying to refine in a workshop the contents of the topic, but this is the most important thing. And you say, yes, okay, this title has everything. This is like an IPBES report. Yes, but it's taken from the IPBES report, and we actually need research on that. Well, having said that, in the meantime, and apart from our topics, the Biodiversity Partnership is up and running, and they have launched last month, and they have a number of flagship programs. The 2 first are biodiversity protection and monitoring. But there is one possible flagship program that still needs lobbying from member states. So you need to lobby your funding agency that are in the Biodiversity Consortium to put the biodiversity and health, One Health and Eco Health there, because these will be 4 years flagship programs that is not only about calls for projects. There are other activities: mapping, foresight, monitoring, capacity building, and this is something that is very complementary to our calls for proposals, and we want this to link to other partnerships focusing on animal health, for example, and to the IPBES Nexus assessment. So this is also going to inform the current IPBES work. So as you see in this 4th, 5th bullet points, the definition of this flagship is quite wide, as they are the calls from Biodiversa. So it's the interaction between biodiversity and plant, animal, and human health, including fundamental research on the causes of pandemics, including science-based solutions to prevent the outbreaks, including solutions, especially local or low-cost solutions to management of wild species, including broader system-wide solutions. It is important to say that the European Partnership on Biodiversity is not only European. It's it is open to all the world. Oh, sorry, I have here things of it's open to all countries. So this is going to be an international call, and we have already a number of countries that are, but first are Brazil and South Africa, but there are a lot of other countries willing to participate in this. What are the next steps? Well, two of the questions that we have, and I'm talking here only on pandemics risk, but as you know, biodiversity and health is bigger. We have some projects on microbiomes, biodiversity. This is something different. But on pandemics risks, the two questions that we are considering now this year is one, which ecosystems generate most risk of pandemics? Two, how do you monitor them for surveillance? And we have asked this request to Eclipse, who is now having workshops with different policy DGs, with different experts. And the idea is to develop a research agenda on biodiversity and pandemics that could inform the future topics that we are going to open, and that could also put the community together. So we need to have it aligned with the funding agencies, as I said, and with the different sectoral policy agendas. So one of the first things that we want to do is to identify and prioritize the ecosystems and monitoring methodologies to improve the surveillance systems for the prevention of zoonotic emerging diseases, which is, yeah, I know this is daunting, this is huge, but at least we can have some pilots on that. And we are actually building on your work and those of PRISOD and OHLAP. And we want, in parallel to, we have asked Eclipse to do a knowledge synthesis and a support initiative to develop a policy support framework on the socioeconomic considerations of pandemic prevention measures. So finally, we are brainstorming for topics. So we are waiting also, we're waiting for the results of these workshops. We are consulting all the partners, all the parties that we can, because we are in the middle of the brainstorming for the topics on the work program 23-24. And you see the umbrella title for now for the biodiversity and health heading is EcoHealth, One Health approaches in natural and modified ecosystems, indicators and multiplying factors like climate change, area prioritization, land use change, etc. So this is now the foot in the door that I have put in the work program to try to define topics from there. And we are happy to receive your ideas and your suggestions, and we are discussing them in the commission with the other DGs. If you want to know more on the partnership, this is the link in the illustration is free of rights because it's my husband's. So the pangolin and the coronavirus and the bats and the ecosystem is something that we want to keep funding research about. Thank you very much.
Thank you very much. It was excellent presentation and important work at the European scale. I think it's good to continue with Saara Vauramo's talk about how those municipal level efforts are going, and then at the end of webinar we have hopefully a couple of minutes time to discuss together and conclude these really interesting talks. Please, Saara.
Thank you so much, and good morning everyone. What a great presentations we've got from Eva, David and Josefina. Thanks a lot. I'll just quickly share my slides here. Just a sec. Okay, I guess they should be in a presentation mode now.
Yeah, it's good. Thank you.
Great. So greetings from Lahti, which is the European Green Capital this year. And my name is Saara Vauramo. I'm the program director for this year, but I also have a background in a city as an environmental director. So I've been working for the city about 10 years now. I have to start with a picture of winning day. What a different world it was. We won the title in 2019 in the summertime before the COVID. And you can see the happy faces, and we thought so differently about the year itself. And of course, we had to create very different Green Capital year as it would have been before in the previous times. But actually, I'm happy for the changes that we've made because of the COVID. And it forced us to look maybe closer, also look at the biodiversity questions more seriously than we would have without this. So I'm pretty sure that at the end, there will be also some great sort of benefits thinking about the environmental policies that cities will be implementing afterwards. Once that we have, of course, that we that finally when we have succeed with a struggle with the COVID, of course. But first, how did we actually became as the European Green Capital? What have we been doing here? So very briefly, let's start with the situation about 30 years ago. Lahti was one of the medium-sized cities in Finland, but also actually in Europe. We have some 120,000 inhabitants. We are pretty sort of regular, normal city in Europe. But we started working with environmental questions quite early because we actually had severe problems with a nearby lake. So during 1950s and 60s and 70s, one of the lakes that we have here was most eutrophicated lakes in Finland, and that forced us to look at the environmental questions a bit earlier than some other cities did. And also at the very same time, we started working with waste management sector heavily, starting offering really good waste sorting possibilities for the citizens. I have to mention that those years there in the early 90s were also in the same time when we suffered tremendously with the economy, because Finland was in an internal economic recession at the time, and our city was one of those that actually really didn't do well. In spite of that, we were able to actually start working with environmental sector. Moving on some 15 years roughly, we go to a point where we did a very ambitious climate strategy. So in 2009, our goal was actually to cut our CO2 emissions from 1990 level into half by 2025. And also at the very same time, there was a financial crisis globally. So my point here is actually that often it's said that cities cannot actually implement ambitious climate or environmental policies in a difficult times or if there is like economic crisis there. But actually our city showcases that those are the times when tremendous steps to the future will be made. And often the crisis points are the moments when there's also some space to invent something new. And really, I think that cities will be starting working with biodiversity questions because of this today's crisis that we have also in economic terms with the COVID. Here's still some pictures about our lake. We grow so fast after Second World War, and that brings us a lot of industries, but also a lot of environmental problems. Here you see a lake. It was actually just a logistical route. We transferred logs through that, but also we actually directed our sewage waters to the lake ecosystem, and it was a mess. Just algal blooms, a toxic place to be. But that was also the starting point with environmental work. Here you see people being part of the program all the time. We were working with freshwater ecosystems for at least 30 years with research sector, but also together with our citizens. And today, when you go there to the harbor, this is in the same physical spot. There's actually one of the best concert halls in Europe, but also a fresh ecosystem where people can spend their times there. They can swim there. They also utilize the area a lot during the winter times. We worked much more with climate questions. And that's also a journey that we are still in the middle of, but a lot has been done already by changing the energy sources from fossil fuels to renewables. We had a People and Planet conference just 1 week ago. And I guess many of the presentations are still available there, and we had a really excellent speakers there, so it was a pleasure being part of that. And the main point was really how to interconnect human health, but also the planetary health, and how to actually approach this situation in a local level. And as we've heard already so much, the current situation creates health problems. Also in a developed countries, we have a lot of them, like the mental health issues. Now, when we look at the newest figures, it looks actually that we are doing quite well here, but the mental health is something that we now have to work even much harder. And I think that's going to be one of the long-term issues with the COVID and with the younger population, that we seriously have to find ways to be more sustainable. So these are much interlinked, and we know that the healthcare, environmental and research do have synergies, but they have been working quite separately. At least here, I think we can actually learn quite a lot from the developing countries, as David said. Maybe they are there. Maybe they have to have this sort of more integrated ways of working. But there is currently a new program that we just launched actually last week, and it's called Nature Step to Health. And Eva actually mentioned also that it's going to be a 10 years program working with the regional healthcare sector, but also the environmental sectors of cities and municipalities. It's about joining efforts to prevent disease, but also environmental degradation. We have a lot of aims there to prevent public health challenges, enhancement of biodiversity at local level, climate change mitigation and adaptation, cooperation between health and environmental actors, and of course also looking at the positive economic impacts. But then we try to connect these different aims with connecting objectives, promoting healthier and more sustainable diets, active mobility and physical activity, then also creating more healthy and sustainable living environments, and promoting exposure and connection to nature. So this is going to be a 10 years challenge for our region, but we seriously hope that there will be other cities, other regions also joining this effort. One of the concrete things what we do here, we have a project called Go Green Routes. It's EU Horizon funded project with a lot of also other cities involved, with different, altogether 40 different partners in it. And what we do here, for instance, as an example, there's going to be a health forest concept that we are currently actually building, and partly also we have made the investments also to there. So here we have the city center of Lahti, and there is the main hospital here, and the planning area of the health forest is over there, and also in a same place where we have here the hospital buildings. Also there are kindergartens and schools for especially needed children and youth, so they can utilize the same space. But we also try to take this health forest and services that it creates as a part of the healthcare and hospital service production. So there's here you see the route here. There are different kind of services over here, but also a smaller route here with completely accessible possibilities to go there. And there's a small lake here as well. So a lot of different kind of things that will be implemented as a part of the health forest, and it will be also investigated the effects of that and the service model that we try to create there in a hospital. In case you're more interested about the finding out about the Go Green Routes project, Jenny Simkin from the city of Lahti will be your main contact point for that. So some findings. Cities do have multi-dimensional role in climate change mitigation, circular economy and supporting biodiversity. But I think seriously that environmental targets are often still poorly interlinked to human health and well-being, at least at the local level. So we are at the starting point to understand this more. Then looking at the local level, so cities versus regional authorities.
Where is it? Outside. Oh.
Someone has now mic open.
Yeah, so I will be
Please, Sara,
quickly
continue.
ending. Yeah. So both are sort of local level players, but in Finland at least the regions have more like a coordinative role. They are important for co-creation. They might share goals, funding schemes, knowledge provision, supporting political commitment, but many of the investments have to be made by the municipalities. So we need to understand the different roles of the local level as well. And when I read the HERA research goals, and for us, this goal 6 is especially interesting because we want to know how to build and support transformational changes. And I think that's going to be the way where the municipalities will be going even much more in the future. But thanks a lot. We have a really nice website as well, greenlahti.fi. So if you want to know more about our city, that's a good way to start. So thanks.
Thank you, Sara. I really much like that you liked our research goal 6 about this transformation. James, I think it's really, really important, promising steps to take forward. We have also really nice questions and comments in the chat. I was thinking that we are a little bit out of time, and I think we could do so that Manolis could conclude all these presentations next from the perspective of HERA project and our consortium and our research agenda, and then we could have time to discuss with those who still have time and want to continue. So I think then we can take 15 minutes and use the time. Please, Manolis.
Okay, so I will be very brief because we are out of time, and it would be nice to get some of the questions. And it's also extremely difficult to conclude in a way because we are talking about very wide issues about complex systems. In the HERA project, we discussed about research priorities, and we are fully aware that most of the research that is being done is not geared into evaluating complex systems, and they're evaluating different parts of the whole system. And we are signaling this issue, and that's important for HERA. But also, being aware of the difficulties of doing research on complex systems, we still have to have research that is, fragmented. And even with fragmented research, we have seen a lot of examples of being able to put things together afterwards and have meaningful interventions. We have this last presentation from Lahti, and many of the interventions that we have been discussing are not necessarily super complex, a result of super complex research. It's based on very, very targeted research. And so we do not have to feel afraid of thinking that this is something so complex that, our own research and what we're asking the Commission, has to do only global research. Now, the issues, though, is that we have to think about research approaches. Much of the research that, for example, epidemiology is doing is based very much on individual-based research. And Eva, for example, was talking about this issue of the need of wider interventions. So wider interventions also have to come from wider type of research, ecological research that is not so high standing within some of the research evaluations, but that's needed. We just have to change and to do different types of research. And definitely, as David mentioned about research capacities, we have to move outside the research that's being done only in some parts of Western Europe or North America or Australia, Oceania, and have to build different research capacities. And that's also a message to the European Commission, and we have discussed it in the HERA project that we were asked to say research priorities for Europe. And by definition, when we're talking about this topic, research priorities cannot only be for Europe. And if we want to address biodiversity in Europe, we have to address biodiversity wider. So, and my final comment, since we have this really excellent, very interesting presentation by Josefina, and we have been talking through HERA with RTD Health, it's fantastic that you're doing the co-creation procedure, and that involves different parts of the Commission and the national contact points from our countries, it would be even better if in this co-creation you could involve directly the researchers rather than filter what the researchers doing through the national contact points. It really would make a difference to have direct contact with where the research is being done. So if you can manage it, within this complex system of evaluation of priorities within the Commission, that would be fantastic. And I don't want to take more time, except for saying that we have to try also from our part, from HERA, to do the best to promote what has come out from this amazing participation of hundreds of people, researchers and stakeholders to develop HERA. And we have to make best use, and I hope that the Commission will make good use of the results of that consultation. So I'll stop here, Rika, because we are out of time, and let's get some questions and comments.
Thank you, Marlis, and thank you all. And yes, let's continue discussing here. Let's continue from the questions. Terry, would you like to raise first one there that we have been planning?
Yes, so we've been collecting the questions here, and the first one that came into the chat that we have saved was from Manolis to David. So he asked, how good is the evidence that fragmentation actually affects biodiversity?
Sure. Thanks. So that's a great question. And I'm no expert in those particular areas, but there's some really nice work done. And one of the complexities with this is a lot of what we are looking at is a mixture of fragmentation and loss. So fragmentation itself, if you have, and there's some very elegant experimental and field work around fragmentation biodiversity. And if you think, well, if you had the same area and then you had fragmented versus not fragmented distributions of species within there, actually fragmentation can sometimes enhance biodiversity, right? So that's complexity, and that complexity works at different scales. One of the issues with some of the things that we're talking about is that it's not always forest fragmentation, it's forest loss or encroachment. One of the interesting issues, and that's around edge effects, but one of the interesting issues, of course, is that if you just clear everything, your risk is gone, if you're thinking about novel pathogens. And so it's at those interfaces where, from a disease risk, you have the most risk. Of course, you have no risk when if we think about forest systems, tropical forest systems that I'm working in. If you have no forest, there's no risk from anything there. If you've got no people, there's no risk, right? So it's when those two meet. But to go back to the original question about the forest fragmentation loss, that's a much more complex issue, and it depends on how you measure fragmentation and the spatial effects and lots of complexity in that. I would add that the work we did on Ebola virus loss, it really was fragmented areas. It was those edge effects of fragmentation, and there may be, talking about complexity, there may be some interesting complex responses. So, for example, some of the fruit bats, and this is speculation from us, some of the fruit bats that we think host Ebola viruses are quite generalist, and they might quite like to have a bit of forest and a bit of a plantation, and so where you might have loss of some specialists, but actually those edge effects and that fragmented forest might actually encourage some other species, and that can change your disease risk profile. So it's complex, but it's a really good, hopefully I answered it okay.
Thank you for explaining. Are there any comments about this, or would you like to continue? Or shall we, Marianne, then take next one, and then we can have this kind of dialogue as well. Please comment if you prefer.
Great, thank you. There is a question to Eva's earlier comment about urban areas from Helena. Is the compact city an answer in the system level? That is, should we still support urbanization?
I'm a great believer of urbanization. I think it is, the human population is going to grow to 10 or 12 billion people, and if we disperse ourselves, that's the kind of end of biodiversity as a whole, because we still need big areas as well. But it's more a question of how you arrange the cities, and a polycentric city gives much more opportunities for building sort of semi-dense cities where you also have green corridors that are needed by the people. So I would see that cities are not necessarily the places of saving biodiversity as such, but the green areas in cities need to be built in such a way that they are persistent, that they can exist, that they can maintain themselves without humans. That's the first thing. And then secondly, that there is access for people, both access in a physical term as well as in kind of mental terms and economic terms, which I mean that people are advised, schools are taking kids there, and people are using, and also in the medical system, healthcare, that people are really made to use the nature as the Lahti experience really showed. So that's my answer. Climate change also requires dense housing, so I see that this is the way forward.
Yeah, densities are supporting physical activity and this kind of sustainable mobility as well. Saara, do you have comments here about from the perspective of Lahti? How do you see this urbanization versus other aspects of sustainability?
Actually, I have to comment that we often neglect also the biodiversity values inside of the city. So there might be actually surprisingly biodiverse environments there in the built nature. Often, like many of the cultural biotopes, they might actually do well there in urban areas as well. And it's amazing what kind of results we've already got from for instance, from the kindergartens, where we researched the like effects to the health of small kids when they had more like biodiverse soils in the kindergarten playgrounds. Actually, it supported so that they had less autoimmune diseases. So it's sort of really a strong showcase that we should also support biodiversity in a very small scale in the city environments. But it's really seeing the value also of the green space. So when there is a green space inside of the city structure, we should support them. We shouldn't build them like almost completely just save them as they are.
Yeah, perfect. What about our chat there? Is there something new to raise here? Or Marianne?
Yes, so we can move on maybe to the next question. And I think it would be nice to ask this question to Josefina from Eva. So why do you restrict to One Health and not include Planetary Health, which is more systems approach to the human nature health questions?
Thank you. No, we don't restrict it to One Health. We started, we had to start somewhere. And One Health is now also because our colleagues from the animal health are helping us to define. But yes, of course, planetary health, eco-health is the way. And I have to say that I'm worried because the main thing that we opened, that was this Nexus topic, didn't get any applicants. So maybe we still need to do some scope on who's there for planetary health, and if these systems approaches are more difficult because you need people from different areas. So I'm happy to take any suggestion or tips or research gaps on the subject. But yes, of course, I still don't know if planetary health and eco-health are the same or not, but we are trying to be inclusive and to put all this kind of and it's not only about the keywords, it's about the way the research is conducted. I'm afraid that it will need a lot of socioeconomic research, and we still have to reach for this part of the community.
Can I connect on this, Rika? There are many many groups in Europe that are working on planetary health, One Health, on different aspects, and it is not always possible to fund a project that will cover, absolutely everything, and this is not necessarily the objective. But we have overall, as a program of research by the European Union, we have to cover all aspects, although it's not necessarily everything in one project. And if you see it that way, planetary health, because it brings the environment also and has this more holistic approach, is really interesting, and it's not a matter of words. So if you see it from your side, I think you just have to make sure that you cover all the aspects, have also some sort of more system approach, but you will not be able to fund only projects that will do everything. You will do also fragmented research. If it puts in context, that's good enough. Then we'll have to put it in context. But if we only do humans and we don't see the also studies that evaluate how the environment affects humans, then we're not doing it well. So I think this is the approach that we have been following in HERA. We are stressing the issue of the need of a new approach, but by definition, projects are done in different ways, and not everything can be done in all projects.
Yeah, could we take the next Eva's and David's comments on this? I appreciate Josefina's comment that Europe is going towards this planetary or more holistic approaches and transformational aspects. And if you, Eva and David, can comment, what could be beneficial steps forward to encourage this bigger thing here?
Could I start this time, David? So first of all, I would like to say that actually the different communities, planetary health and One Health and One Sustainable Health, they are all, and pre-ZOD as well, they are all working very closely together, and I'm working in all of them at the moment. So I don't really see that one is my pet or something like that. And one way to get over things is either list them all or then actually open what you mean. And from this perspective, I am still emphasizing the systems approach. And in systems approach, you can do this specific research that Manuela is bringing into the discussion. But the systems approach is not as difficult as always thought, because actually you are anyway, we need the research projects, we need actors, we need, in a way, a transdisciplinary approach. And if you take that kind of approach, you very easily drop into this systems approach. And it's not as difficult, actually, what it sounds. My experience says that when people that are asked to do systems level, first of all, it's kind of shock, it's impossible to do. But when you start to do, you really realize who belong to it, and you can keep it much more open to outside. So from these points, I would still encourage that we don't go from one problem to another problem by solving the first problem, is to really take the systems approach. And this we have seen that we are doing already in energy sector and in food sector and so forth quite nicely, also with the Commission's funding.
Yeah, and of course, this kind of capacity building is needed also here, and then we can do together better work in the future. Yeah, thank you, Eva. And
well,
please, David.
I take your comments. I take
course,
your comments and the need to emphasize the systems approach in all these kind of topics. And I understand that one project cannot do everything. We are now moving to the portfolio approach. So several projects in the same area that communicate.
Yeah.
Perfect. Okay, David, please.
I just want to comment on this. So because talking about differences, so some depending on where you come from, people do perceive things as different, right? So the One Health came from the biomedical sort of zoonotic diseasey thing, and eco health came from more grassroots about environmental health and people within it. And so I think those terms can put people off. And I have thought about this a bit, and I like the systems approach idea, but actually I think if you said these are the problems we want people to solve, and actually you don't constrain that to how you're going to solve those and from what backgrounds, because these are problems that need interdisciplinary approaches. Of course, sometimes they need very disciplinary specific problems solved. But I think sometimes if you come about from these are the problems and you come to us with your ways of solving those problems, you might actually get more interesting ideas and solutions. And you might find that you get a broader range of people applying because of that pigeonholing. Right, okay, that's eco health, that's planetary health, that's this. So even though I believe it's all kind of the same thing.
Exactly, this sounds really good. We have in Finland the Strategic Research Council funding exactly this kind of problem-based project that they state that this is the challenge that's Plea Combined Consortium, combining at least 4 to 5 disciplines at minimum, and then we are trying to solve together these social challenges and agree that can be one way forward. Yeah, definitely. Okay, would you like to comment these proposals or ideas? Okay, really interesting perspectives. Do we have there in the chat more comments? Okay, Marianne, please.
Yes, we still have 3 questions, and all of them are for David, and one is for David and Eva. But let's start with the question from Emmeline. It's on the role of land use change and development in pandemic emergence and the need for reform. So are you aware of any ongoing research on potential policy instruments which could trigger such changes and any associated outcomes?
Partly, there's a big gap. If I just get that right, so yes, so there is research on the policy and the gap. There are people doing that, but I think that, for example, there was a paper in Science looking at the cost of mitigating some of the drivers of these, so biodiversity loss, etc., and it was billions, right? So it was lost. But then they put it in the context of the disease emergence outbreaks. So, for example, COVID has cost trillions, right? If you just put it in monetary value, ignoring the social harm and the loss of lives. So there have been some, but I think this is one of the big gaps, and that's one of the reasons why, say, for example, the OLEP group has been brought together, why there's that IPBES review, because those policy gaps have fallen through the gaps. And if you look at what exists now, but part of it, I think, is because it's quite hard to attribute some of these things to the broader drivers. So that attribution is quite hard. So it's quite hard to pick and say for sure where, that thing caused that. If you go up, so you have the kind of proximate and ultimate drivers. So where you are along that tipping point. So that the reason someone might have got Ebola virus is because they picked up a dead gorilla that they took home that was infected, but actually why was that there? Why was that scenario created? There's just in those policy gaps. I mean, if you look at a lot of the policy that exists, it doesn't include the disease aspect. So you might have CITES that looks at wild animal trade, but that's really only about species extinction. It doesn't look at disease risk. Some of the disease focused ones just look at the economic impact, or so there is some work, but I think there needs to be much more, and I think this is a big gap. Is what are the policy gaps? How do you fill them? How do you work together? And that's one of the reasons why things like OLEP have been brought together. But we won't do it alone. We'll need lots of support. But that's one of the problems, is that so far everything's been very siloed. I think that answered the question. Sure, I'm happy to follow up.
Yeah, great. Thank you. And do you want to comment, or was it? Yeah, thanks, Emily. And should we, Eva, you wrote here that you would like to continue from this developing countries question with David. Shall we continue?
If I may quickly, there is another question related to that theme from Katka. David mentioned in his talk that people in poorer countries do understand the link, but do they also act at the policy level? Can you please comment on what you see in the field? And then Eva wanted to elaborate on the research as well, so we could go into this theme with you both.
Yeah. I mean, I don't, I don't think anything should be looked at through what we'd call rose-tinted glasses. There's strengths to be found in many places. There are some concrete examples where, so for example, if I think of Kenya, and I don't know, apologies if anyone from Kenya is watching, but for example, Kenya would be a country that actually has a coordinating office for One Health that is supposed to coordinate the work in the Ministry of Health between the Ministry for Agriculture, Livestock and Fisheries. And so that is a national level system, and then there's research institutes underneath that, like Hemorrhagic, which actually then have kind of One Health section, and they do a lot of really good work. And within that, they begin to think about the environment. I would argue that environmental aspect is what is missing in many of these, and that's where it still comes down to that biomedical kind of human health zoonotic disease angle. But there are some good examples where that's been done well. Bangladesh has a nice program around Nipah virus emergence that looks at interactions between humans and fruit bats, for example. So, but there are some examples where they're written into national policy, which I think is the question. But generally, again, sorry, just going back to that previous comment about the policy gaps, generally these things are very poorly done, and the policy gaps and the linkages are not made. Or if they are, they're on paper, and then it doesn't actually filter down to on-ground action, and that's true of many countries. And so, Eva, you probably want.
Okay, thank you, David. And I was saying to say that Sara is also leaving, and many people are leaving, and we could maybe start finishing after a few comments, because I think people are leaving, and they maybe it's much more comfortable for all of us to make this full stop here in some way. But yes, please, and Eva and David, if you have, and others, if you have final comments, so please, let's take them now.
Yes, I think it's also a good idea to stop. Otherwise, those who leave, they miss such nice discussions. Anyway, so I would also like to come back to this issue, because I haven't been working myself in developing countries, but working on the global level on sustainability capacity, and realized that actually the science capacity between the developed and developing countries is just so incredibly large that now when I'm thinking about the centers that you, David, showed, for example, in Africa, I would say, I believe so, that most of those are run by institutions in the developed countries. And that's fair enough. Medical studies, what I've understood, are highly expensive. So from that perspective, it is justified. But the challenge, at least from the sustainability perspective, is that when there is no local and national capacity that actually are of research in different parts, is really causing these difficulties nationally and locally. The kind of suggestions are coming from outside, and there is also no there are lots of challenges in the science policy, in particular in these countries, in the sense that there might be one professor who is then just chosen as a scientist answering to any questions of such, and it's yeah, there's a lot of things to do, and it is part of this open research where I see that the developed countries have a lot to do, not only to go there to do studies, but actually to raise the capacity in those countries to carry out the research. And this is something forward-looking, because we are not solving a problem today, we are solving a much bigger elephant than the COVID ever is. And for that we need to build something for the future. And having this power from us, we can see it with the vaccines, which is one part of it, is just huge. So I would say that this is the case, but despite this, I would say that now in this One Sustainable Health initiative that I've been, or forum I suppose it's called, there's also active participants from several developing countries, and they are often NGOs, and they are very holistic, or not holistically, but system level approaches, with system level approaches coming to the system. And I think this is again a flexibility that we often are missing in developed countries. The flexibility that they do have, that they are very sector specific, but then on the other hand, they on local level they are able to take a broader perspective. That's my understanding, but I would very much like to hear, David, your views, who you are really working there on the ground, how you see it from this side.
Yeah, so no, I agree. Some of those are huge problems. But there's, like you said, there's also opportunity in terms of the way people think in some of these countries, that they totally get what we're talking about. Yeah, I mean, I could answer lots of those bits. I'm not sure we've got the time now. I think I'm not underestimating some of the barriers for some of the things in some of these countries. I mean, just trying to establish good infectious disease platforms, for example, even though it's quite well funded compared to other areas potentially that we're talking about, is extremely hard in some countries. But that doesn't mean that there aren't other solutions that aren't totally dependent on some of the technologies that we use. And I think that's where we need to be much more open-minded and holistic, and engage with people, and not actually go, well, here's how we think it should be done, and listen to the problem. And then just one last comment. I think, like you said about the inequities around vaccination access, you know, I think in terms of these drivers, we are not all innocent. I mean, I sit here and, you know, my phone has components from Central Africa in it, right? So, and the coffee that I drink in a day will come from probably West Africa or maybe Central America. So, you know, we all play our part in what is happening in the world now, all over. So I think we need to recognize that. Right.
Yes, definitely. We are playing our parts in many things. Thank you for this excellent day today. Wonderful presentation, and I really much appreciate this discussion afterwards, and you gave your time to this discussion. Really valuable. And as Katka has mentioned here in the chat, we have been recording this discussion or this webinar, and after a few days it should be on the HERA's website, and then others can also see and read comments maybe. But I think it's really valuable to show these presentations to wider audience as well. And I would also like to thank to all who have been organizing this webinar, but also those who have been listening to you, because it's really valuable that you joined us today. Thank you all, and have a nice day.